Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning. Good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And we are going to be talking today to an extremely accomplished woman. And I love that. I love the accomplished and I love the woman part, right? Because we always need to be having more extremely accomplished women, right? So please join me in welcoming Dr. Jaclyn Tomsic to our program today. Welcome, Jaclyn. How are you doing today?
Hi, good morning, Deb. Thank you so much. I am doing fabulous. It's a Friday morning here. We're recording, It's TGIF.
I love it.
And yes, and it's a beautiful day. August, autumn day. Well, no, summer.
Yeah.
Let's not push it. Let's not push it. I know people are trying to push that.
Yeah, because you get snow. I don't get snow. You get snow.
I get snow. But thank you so much for the invitation to come on your podcast. I'm really excited to be here, and I know we're going to have a great conversation.
Cool. Well, let me tell people about you, and it is a great accomplishment list, and so I want to make sure that we get all of it, because let's be honest, sometimes as women we shorten our bios, right? No, we're not going to shorten yours at all, because it is very accomplished. So Dr. Jaclyn Tomsic completed her oral and maxillofacial surgery training at Detroit Medical Center, rotating through level 1 trauma centers, including Detroit Receiving and Henry Ford hospitals. She earned her medical degree from Wayne State University and completed a general surgery internship and chief year in OMF surgery. She then completed a fellowship at Georgetown University Hospital and the Posnick Center for Facial Plastic Surgery, focusing on jaw reconstruction, orthognathic. I knew I was going to do that. You say it.
Orthognathic.
See, then I got you messed up. And facial plastic surgery. After another year as a surgery resident at Washington Hospital Center, she completed a fellowship in facial, cosmetic, and TMG surgery at Mercy Hospital in St. Louis, earning a fellowship in the American College of Surgeons. Now based in her hometown of Cleveland, Dr. Tomsic focuses on facial cosmetic surgery, trauma, and implant surgery. Outside of work, because she does have an outside life, she enjoys sports, fitness, travel, and time with her family and friends. So again, Jaclyn, welcome to the program.
Well, thank you for that very gracious bio. It's very kind. I'm very, very proud of all of that. So thank you.
You should be very proud. It is quite the accomplishment. And we're going to talk more about why it's such an accomplishment for a woman to have all of those very prestigious credentials later. But tell us, how did you get to where you are today?
Sure, absolutely. So when I describe this, I like to say, like many things in life, it was not linear. I took turns to get here. I always knew in high school that I wanted to do something in the science field because I enjoyed it. I was kind of good at math and science. So I went to undergrad at a school called John Carroll University. It's here in Cleveland, very Jesuit university, very, very beautiful campus university. And I majored in chemistry. So I was a chemistry major because, again, I enjoyed science. You don't really go into a chemistry major without enjoying science.
Right. That's a lot of work.
It's a lot. It's a lot. And maybe it was an accomplishment thing for me too, but and so during that time, I decided to pursue dental school and apply to dental school. It was always going to be healthcare, medical school, dental school. And I'll get into a little bit of why that's a little bit funny for my personal story. But so I applied to dental school. I was accepted into a number. I chose to go to Boston University dental school. I grew up in Ohio, as you said. John Carroll is on the east side of Cleveland. I grew up on the west side of Cleveland. So it was about a 45-minute, I lived on campus, but like away. So at that time in my life, I was ready, my early 20s, to branch out. I wanted to get out of the state of Ohio at all costs. So, I had an uncle who was very influential in my life growing up. He lived in Manhattan. He was in the music industry. So the family and myself in general, we had been to the East Coast a lot, and I had kind of fallen in love with it. So I wanted to go East. And that's how I ended up at Boston University, and fell in love with Boston immediately. Like, it was a fabulous experience. I still love Boston. We're actually, I can't believe it, going back for my 20-year BU reunion in September.
I love it.
Crazy how time flies. So I went to dental school, not thinking that I was going to be a dentist. That was my plan. My actual plan was, I love Boston. I love the city. I'm going to live this life forever. And that's why, one of the reasons why I also chose Boston, because, you get in with people. Maybe I get a job in Boston after I leave, or after I graduate. But about 2.5 years in, into my third year, which was our clinical year, we rotate through different dental specialties, and one of them being oral surgery, oral and maxillofacial surgery, oral surgery for short. And I didn't really know much about it, but I enjoyed it. And to their credit, I had some really good pre-doctoral mentors when I was there, who, I guess they saw something in me looking back, the drive to do it, because it's definitely not for everyone.
Right.
But they really encouraged me to think about it. Like, you should really pursue this as a career. And that was the first time I ever thought about it. So, and then it kind of blossomed through there. And so by the time I was almost graduated, like my fourth year, I had made the decision that, yes, I think they're right. Let's give this a shot. Now, however, in that instance, if you're talking about medicine and residencies, like, you have to kind of decide a little bit earlier. So the application season had already passed.
Okay.
So I decided to do a transition year in a hospital setting. So I took a position in dentistry. It's called a general practice residency. So you're doing dentistry. That was the last year I ever did dentistry, but you're still doing dentistry in a hospital type setting.
Okay. So more like emergency situations.
Emergency situations. We had a dental clinic where we did just, the same stuff you'd get at your dentist, fillings, crowns, and stuff like that. But we also were in a hospital-based setting, so we did take emergency call. We also did some other rotations within the hospital. We were talking before I'm going live about ENT. That was one of the rotations that I did. That really, I still remember that doctor. His name was Dr. Don Kammerer, and he was an ENT, head and neck surgeon. He just, amazing surgeon, beautiful surgery. Like, the dissections that he did was just amazing. So, like, it really motivated me to, like, man, I loved the OR. I really love the OR, and that's what oral surgery is. I took a position, and that was in Charlotte, North Carolina. So I did that for the year with the intent of going to and applying to oral surgery, which I did during that year. And it's, it's pretty early in the year. So anybody who's in any type of medicine or dentistry, the application process is always in the fall. So the academic year is always July 1 to July 1. Okay. So, like, you enter one of these positions, and then, like, within 2 months, you really have to start getting your applications in. And so sometimes it can be a little bit challenging because you don't, especially if you enter a new place, you don't know a lot of people. The people don't know you. Right. But you're asking people to write you letters, kind of type thing. But it usually works out. It did work out. So I applied during that year. I interviewed, and, I always say, and I'm very grateful for this forever, I was lucky. I matched to my first choice, which was in Detroit Medical Center, Wayne State University. And for those of you out there who don't really know the path to get to become an oral surgeon, there's 2 different paths that you can take. And so everybody does go to dental school first. Okay. The majority. There is, like, I guess, non-traditional way you could do it. You can go to medical school first,
Mm.
but that's very rare.
Mhm.
Most people go to dental school first, and then they apply to oral surgery residency out of
Mhm.
dental school. And there you can do a 4-year program or a 6-year program.
Mm.
So it's 4 to 6 years additional on top of the 4 years of dental school.
Whoa.
Yeah,
So that's
yes.
10. You know, if I
That's
did my math right, you know,
10 at the
10-ish.
baseline, then you
Mhm.
have obviously whatever does undergrad.
Mhm.
So yeah,
Mhm.
they add up quick, I guess.
Mhm.
So, and me being just the kind of person that I am, I had decided also. So the main difference between a 4-year and a 6-year is the 6-year, the additional 2 years, you obtain a medical degree. You
Okay.
actually
Mhm.
attend medical school,
Mhm.
do all the medical school rotations,
Mhm.
requirements, tests, and you graduate
Right.
as a,
Mhm.
medical student.
Mhm.
So I had decided that that was really something that was important to me.
Mhm.
So I only applied to 6-year programs
Mhm.
that included that component in
Mhm.
the training.
Mhm.
So, and that was the case for my program in Detroit,
Mhm.
which the program is still around. The medical degree, they have dropped that. Unfortunately, the
Mhm.
residents who go there now don't get that. But again, it's a
Mhm.
personal choice.
Mhm.
So I was in Detroit for 6 years at the Detroit Medical Center.
Mhm.
As you stated, Wayne State University
Mhm.
was the medical school. Amazing, amazing
Mhm.
experience. I cannot talk enough about my experience at Wayne State,
Mhm.
at the DMC, Detroit
Mhm.
Receiving, at just in Detroit in general. It
Mhm.
was an amazing place to
Mhm.
train. And I remember this. I do remember
Mhm.
this. I was doing my rank list. We all do our
Mhm.
rank lists, and I was like, you know what? I'm gonna rank Detroit number 1
Mhm.
because people probably don't want to go to Detroit. And I'm like, I'll
It's
go there.
Detroit.
Yeah. I was like, I'll go there.
Right.
And
Mhm.
it worked out for me.
Mhm.
And so, 6 years of residency,
Mhm.
medical school. I graduated from medical school in 2010.
Mhm.
Graduated from residency in through 2012.
Mhm.
Then, as you stated, from residency, I
Mhm.
still, for whatever reason, didn't feel like I was done yet. That's when I went to DC
Mhm.
to do my fellowship with not kind of, a well-respected
Mhm.
guru in
Mhm.
our field of oral maxillofacial surgery, Dr.
Mhm.
Jeffrey Posnick, focusing on orthognathic
Mhm.
surgery, sleep apnea surgery,
Mm. Okay.
and some facial
Mhm.
cosmetics.
Mhm.
And that was at Georgetown.
Mhm.
I did that for a year. Then I did something which is very, very unusual in oral
Mhm.
surgery. There's a few people maybe out there who have done this. I wasn't ready to leave DC just yet. I took a position as what was called a non-categorical resident in a general surgery program. So,
Ah.
and it was a PGY2.
Mhm.
So, in medical terms, your PG is postgraduate
Mhm.
year, and the number is how many years postgraduate you
Mhm.
are
So you were
from
2 years postgraduate.
medical. Right.
Mhm.
So
Mhm.
I did 2 years of a general
Mhm.
surgery training, which is very, very uncommon for
Mhm.
most oral surgeons. Most oral
Mhm.
surgeons do less than one,
Right. Yeah, they're
honestly.
they're focusing on neck-ish up, right?
Right. But I did that, and
Mhm.
I loved it. I mean, it was
Mhm.
I've always enjoyed general surgery. I
Mhm.
mean, there was a time when I probably thought that maybe I could do that as well, but
Mhm.
I'm happy with where I
Mhm.
am, but I'm also happy with the foundation, the surgical foundation
Mhm.
that I gained
Right. Mhm.
from that intense training. And then so I was in DC for two
Mhm.
years, and I took a job.
Mhm.
Well, then I took a job slash one final year of a kind of like self-made
Mhm.
fellowship. There was a fellowship in St. Louis, and it
Mhm.
is kind of like make it what you want. They
Mhm.
have, so I focused more on TMJ. They had trauma there. I saw a
Mhm.
lot of trauma, as you
Mhm.
can imagine. I trained in Detroit, so
Mhm.
trauma was
Oh, a lot of
also
trauma in
a
Detroit.
lot of
Mhm.
trauma. So
Mhm.
I mean, that was like the back of my hand.
Mhm.
So I did that final year in Detroit, or I'm sorry, in St. Louis, where I was still like in a learning educational
Mhm.
position, and then with the intent of staying with that same group, which I did for to work
Mhm.
as a associate
Mhm.
in the practice, and I did that for 5 years.
Mhm.
So, and then I decided to come home to Cleveland after all that time. So that is my roundabout way
Mhm.
how I got to where
Mhm.
I am.
Mhm.
And to go back to the irony for me is that I remember, growing up, I excelled in academics, and it was always very important to me. Academics and athletics were always like 1-2. That's what my focus was and my passion was growing up. And so growing up, if you're smart in, especially in my family, that you got to be a doctor, you got to be a doctor.
Okay.
And so,
so were there other doctors in your family?
none.
Ah,
There's
okay.
none.
Interesting.
Yeah. So, but because when you're young, you're a little bit rebellious, and I am like, so
Yeah, you're like,
like
no.
I am not that rebellious at all. So this is my way of rebelling. Is I was like, no, I'm not going to go to medical school. I'm going to go to dental school.
Right.
Which is like, I always laugh at it because like in my mind, in my like young mind, 18, 19, 20, when I'm thinking of this, I'm rebelling and, against my parents.
Right.
And my parents are like, okay, like, we're proud of you. Like, that's,
Yeah.
like, I wasn't like, I'm not going to go to school. I'm going to go.
Right. I'm going to go weave baskets.
Right. Which there's some amazing basket weavers.
Yes.
But
and we need basket weavers.
Yes,
so,
yes, we do. So I always laugh because I'm like, they had the last laugh because they're like, okay, go do that. Like, we're so happy about that.
Right.
And then the final irony is the fact that in the end, I was the one who chose say like, yeah, I really, it was
they
important
knew
to me to go to medical school. To this day, it's one of my proudest days is graduating. Well, from both dental school and medical school, but I really have just a passion for medicine. I feel like very privileged to have that degree and to have that knowledge. Really, I mean, the degree comes with knowledge, but the knowledge of the human body, I think, I still find to this day very fascinating.
Right. Well, oh my gosh, so much to unpack.
Sorry, that was very long.
That's all right. That's and I knew it would be long because, as we said, you are very accomplished. I think it is one of those things that making all those decisions along the way. I mean, it was it had to be very challenging, especially as a woman. And we were talking about that before. We still don't have a lot of females in and it's still kind of broken out that women are nurses, and now they might be nurse practitioners, PAs, right? But doctors are men, and I put that in my little air quotes, right? And so did you find it challenging to be a woman in all of these fields, especially surgery, because surgery is a very male kind of dominated type of thing?
Oh yes, absolutely. So number of different points I want to make on this. Yes and no. Yes, obviously. So in my specific specialty, oral and maxillofacial surgery, there's studies obviously that are done on this. And the percentage of females today ranges anywhere between like 8 and 20%, depending on what source you read.
Right.
And we're pretty much one of the least female specialties, surgical across medicine. We rival that, like cardiothoracic surgery is also kind of those numbers, neurosurgery, those are the two, in orthopedics. And I, looking back, hindsight's always 2020, reflecting on my journey, I think that the reason I really liked general surgery so much was because general surgery is one of those surgical specialties that is equalizing and equalized. There is a lot of females in general surgery on all levels. And I loved that. And I found a lot of companionship and camaraderie with a lot of my general surgery colleagues when I was in training, some of which are still best friends today. My one general surgery gal, I mean, I just talked to her this week, so we keep in touch. And so that definitely did have an impact. And it's still an impact today. I mean, I'm not here to get into like my sob story about how I've been discriminated against, which I have as a woman, and treated differently. Oral surgery is still very much a good old boys club. It definitely was when I was in residency. But again, I do give credit back to the mentors in dental school who are both male. and saw something in me. And actually, I distinctly remember this. One of them telling me, you know, we need more good, strong females in this specialty. And I respect him for saying that and for, you know, encouraging me.
Right. Because he
then,
could have said, it's going to be really, really hard. You might want to think about something else.
Correct. He could have. And, you know, that probably could have had an impact because just that statement from him, again, at the time, you don't really realize it. But looking back, like it, all I looked at when I was just making my decision and then once I decided I was going to apply, I was just like, this is a career I'm really excited about and I want to do this and I'm going to go for it. I really, maybe in a way I was a bit naive, but it worked out in my favor. I didn't really think about me being a female in this field at all.
Right.
I thought about me just this something that I want to do. I'm going to give it a shot. And like I said, I to this day, female, male, it is a competitive specialty to get into. There's a lot of people that would really, the envy would want the spot that I got. So I never take that for granted. I never take it for granted that I get to do what I do as an oral maxillofacial surgeon. Because again, there are a lot of people out there who would want to do it for many different reasons. And there's a lot of reasons why they maybe didn't or couldn't or, you know, shouldn't. But, you know, that's never something that I take for granted. So that's where like the no comes from. Like I didn't really think about factor that in when I was applying to oral surgery. And we are treated differently in some circles, you know, still, unfortunately. I mean, even within the last 3 years, I have definitely been discriminated against, gaslit, everything by a group of males, mainly older males, average age above 60, in a oral surgery department, academic setting that just, I'm sure, just did not like a strong female, you know, and, you know, and man, I didn't realize what gaslighting was until that experience. And I will tell anyone like, man, that is one of the worst experiences to go through because it really messes with your mind. And it really messes with a lot, emotional, mental, your focus, your belief in yourself, which I think is just the most egregious thing. Is that like, I think I would be okay if someone said to me, I just don't like you and we want you out. We don't like you. I can take that because I'm a very like realistic person. Like what you see is what you get.
Right. And some people are going to say yay, nay, you know, all those things.
Like not, I don't like everybody and not everybody's going to like me. And I could accept that, but to be gaslit and, you know, told, you know, just to be torn down, by people who just really don't like you by lies. And
the manipulation
yes. And, you know, for those of you hopefully out there who have never been gaslit, don't really know what it is. I'm sure it's like a hot button, like topic, like I actually looked into the meaning of the word and the origin of the word. It was from like a movie in like the 50s or 60s. So the movie's been like out, or the word has been out for a long time, but I feel like in the last 10 years, like you hear about it more. But there's a lot of those words that you hear about, but you don't really know what they mean.
Because you're not experienced in it. So, which is good.
Which is very good. And I don't wish it on anybody because it is a very dark place to be. And it's basically when someone like, they just they say lies about you. They say their truths. They say their opinions of you, really. But they say it with such conviction and they do, and the things that they do, that you start to question, is that real?
Right.
Are they right?
And because they are the voice of authority, other people very readily believe them.
And to, you know, kind of maybe bring this to a close, this to question is that, you know, there's not a lot, it's easier for someone, especially a male, to just stay in the group. Like there's a lot of people, it's hard. It takes a lot of courage to stand up and say what's right and say, because there's a lot of people who, you know, could overlook these situations and say like, you know, she's really being treated unfairly. Like these things like are kind of stretches and they clearly just want to get rid of her. And, but the majority of people are just going to go along with it. you know, because it takes courage to stand up. And that was unfortunately my
Right.
experience. No one stood up for me. And they got their little like group of people even to like
The boys
support
club.
them, the boys club and whatever. And that took a long time. I mean, I still struggle with it today. But I also try to use it as a source of motivation.
You're going to prove them wrong.
As my mom has said, and many people have said, you know, success is the best revenge.
Yep.
And so to anybody out there, and I don't want to get down because one of my points of talking is obviously to spread the word about oral surgery and definitely motivate other females to get to get into it. And that story definitely is not motivating if you're listening. But what I will say,
it is motivating because you got out of it.
Well, thank you. Yes. And the motivating part to me is that, yes. And this took a long time for me to understand and to kind of accept and acknowledge. And still, I struggle with it today. Is that, yes, they can knock you down for sure. And they did. They did. But they can never knock you out. Only you can knock yourself out.
Yes.
And they can not like the way you do things, which they didn't. They can criticize your training because it's different from yours, which they did. They can, you know, make their quote truths about me to try to other people to believe them, which they did. And they could say just, you know, false facts about me, which they did. However, all of that said, I completed training. I have my training certificate. I passed my boards. I'm a board certified oral and maxillofacial surgeon. I have a license to practice medicine and dentistry. And I have the ability to continue to be an oral and maxillofacial surgeon.
Yes. So and you are, as we've said, extremely accomplished at this.
And I thank you. Yes. And I work hard at it. So all of that they can do. What can't I do? I can't practice within their little bubble.
Right. And that's okay. You don't want to be there.
No, I do. And that's also something to get through because there was a time when I definitely, you know, that was hurt. Like it was something that I enjoyed. I thought I was good at. But then you get to a point, and this is, you know, you work through different things. Everybody does it in different ways. You get to a point where you're like, and this is what I got to, I'm not interested in being somewhere where I'm not wanted.
Right. Yeah.
Or I'm not respected. You know why? But I also acknowledge that there are people, and that's a human kind of like emotion. You want to be accepted. And you want to prove people wrong, like, because that's a very big, I think, feeling for humans. I don't think it's unique to me. So you want to prove these people wrong. These people have accused you of something. They have a truth about you that they just spread like wildfire. And that truth is not your truth, and you want to prove them wrong.
Right.
And it takes a lot of strength and courage and acceptance, really, to kind of give that up. And that's what I had to do, because you're just hurting yourself.
Right. Right.
I read recently a fantastic book. It's called Forgiving What You Can't Forget.
Oh, I like that idea.
Yes. The author is called, her name is Lisa Turkhurst. And just the title alone, I think is just very profound.
Right. Yeah, because we're always going to remember it. I mean, it's not like we can, you know, wipe that slate clean and have those memories gone. But how we choose to deal with it going forward is what's important.
Correct. And how forgiving it in a way and letting it go sets you free. And it's very simple, but it's very difficult. Especially when you're hurt. And that's why I go back to, you know, I tie that into success is the best revenge, because we all want revenge. You know, what did I want the most out of this situation was I wanted someone to take it back, basically. It's you go back to like very like adolescent kind of like feelings.
Right.
Like I want them to take back what they said about me.
Right. And to say, I'm sorry.
Yes. And to say I was wrong. I did that because I am hurting, which if you read and you know, the psychology of it, I mean, why do people bully? Why do people, you know, say mean things? it's because they're hurting on some
Right.
level.
It's their self-esteem issues. It's their jealousy. It's all and rationally we know that, right? But it still hurts.
Yes.
I mean, that's the thing I think that people need to remember is, it still hurts. And acknowledge that and go, okay, it is their problem and their fault, but it still hurts.
Yes. Um, so that would be my motivation. So
Mm-hmm.
I'm trying to
Mm-hmm.
take that and just
Mm-hmm.
use my
Right. Mm-hmm.
platform, my small
Mm-hmm.
platform, whatever it is,
Mm-hmm.
my brand, my voice,
Mm-hmm.
to spread the word
Mm-hmm.
about my specialty, to spread
Mm-hmm.
the word that there are females in
Mm-hmm.
our
Right.
specialty. And,
Mm-hmm.
but also within medicine, within
Mm-hmm.
dentistry, we have to stick
Mm-hmm.
together,
Mm-hmm.
because that's a whole nother story.
Mm-hmm.
Women can also be their worst enemies to
Oh
other
my gosh,
women.
women kids can get so catty and so nasty. Oh, mm-hmm, mm-hmm,
Yes. So we have to fight that
mm-hmm,
too. But just, it's if you're out there and you want to do
mm-hmm,
this, you absolutely
mm-hmm.
can. Like
Right.
it's and it's
Mm-hmm,
it's a great
mm-hmm.
specialty.
Right.
Now you have to love
Mm-hmm,
it, love what you
mm-hmm,
do, which I
mm-hmm,
do.
mm-hmm,
Um, as in anything in
mm-hmm.
life. But
Right.
so I try to use that as
Mm-hmm,
motivation, and that's really
mm-hmm,
my main goal
mm-hmm,
in all of my endeavors
mm-hmm,
with my career. Is to not only be a
mm-hmm,
good surgeon, be a good
mm-hmm,
doctor, but also just
mm-hmm,
encourage other all people, but
mm-hmm,
especially
mm-hmm,
females, to be a part of this
mm-hmm,
specialty on any level,
mm-hmm.
really.
Right. Right. And of course, what you talked about happens to women everywhere. And it is a challenge, because in many cases we're also dealing with, hey, we've got kids, we've got this, we've got that, and all of those things. And you mentioned it several times, and I want to hit on it: mentor, 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 mentor. If you are in business, if you're in medical, whatever it is, reach out and help people. And as you said, it can be the same or different sex, right? Just how can we raise everybody up? Because it's that sinking ship, right? We're going to raise everybody up. And mentoring is one of the best ways to be able to do that.
Yes, and to touch on that point a little bit more is I think people think of mentoring and maybe it's a little bit intimidating.
Mm-hmm. Or like,
Um,
ooh, am I worthy of being a mentor?
Correct. Or a lot of people, I mean, we're all busy as
Mm-hmm.
we
Right.
started this conversation
Mm-hmm.
where all of us are busy. No matter
Mm-hmm.
what we're doing,
Mm-hmm.
everybody's busy.
Mm-hmm.
And people feel like I love to do that, but I don't have enough time.
Mm-hmm.
And I think mentoring, there's no black and white definition of
Mm-hmm.
what a mentor is.
Right.
And there's no like,
Mm-hmm.
okay, you have to
Mm-hmm.
dedicate 20 hours
Mm-hmm.
a month
Right.
FaceTime
No.
contact to
Mm-hmm.
your
Mm-hmm.
mentee in order for you to
Mm-hmm.
call yourself a mentor.
Mm-hmm.
No, not at all.
Mm-hmm.
Like you can mentor someone
Mm-hmm.
in a day, like
Mm-hmm.
someone
Right.
who comes and, observes you.
Mm-hmm.
We have a lot of people who want
Mm-hmm.
to observe us.
Mm-hmm.
I think, especially in the medical field,
Mm-hmm.
where perhaps is a good that people probably don't think
Mm-hmm.
about this as mentoring, but it very much
Mm-hmm.
is that the people that we work with that support us
Mm-hmm.
are surgical
Mm-hmm.
staff.
Mm-hmm.
We have nurses, we have
Right.
assistants,
Mm-hmm.
um, front desk people,
Mm-hmm.
schedulers,
Mm-hmm.
billers, like all kinds of
Mm-hmm.
people. They're all working, whatever specialty you
Mm-hmm.
are, they're working on it just at a
Mm-hmm.
different aspect.
Mm-hmm.
But it's important for them to understand what you do because at
Mm-hmm.
the end of the day, everybody is there to support the
Mm-hmm.
surgery on some level, in
Mm-hmm.
some way that you are performing for
Mm-hmm.
people. So
Mm-hmm.
it just makes the whole process
Mm-hmm.
run smoother,
Mm-hmm.
especially on the patient
Mm-hmm.
end. I mean, you don't know how many people. So I'm an oral and maxillofacial
Mm-hmm.
surgeon, but and sometimes I struggle with this at times. We all do because a lot of people just be like, "Oh, I'm going to the dentist," and for us, that sometimes can be taken a little bit
Right. Because you're
as a
that plus.
right, Rich, and it's like I'm
Mhm.
very excited to
Mhm.
go to my dental school
Mhm.
reunion. Like,
Mhm. Right. Mhm.
however, like yes, but I'm also a surgeon, really,
Right.
and
Mhm.
I'm also a
Mhm.
physician, and
Mhm.
I have all these other hats that
Mhm.
I wear.
Mhm.
Um, but my point to bring that up is that we have so many patients who that's how they look at us. And
Mhm.
again, they're not trying to put you down or
Mhm.
anything by any means.
Mhm.
but they'll come in and say, I hate going to the dentist.
Mm-hmm.
I hate the dentist.
Mm-hmm.
Which is something that it's like, and they always feel the need to tell you that.
Right. Yeah. I
Which
always
is
tell
like,
my dentist, I always say, I love my dentist. I mean, I was very fortunate when I was an itty bitty little kid. I had a very good dentist. And it was one of those things where I was, because I had such a good dentist when I was young, he set that foundation, right? So I was never afraid. I didn't hate to go, all of those things. But we feel like that with our doctors too. Oh, I hate going into my doctor.
Yes. I have people say that every day. I hate doctors.
Mm-hmm.
I avoid them. And there's different,
right. Yeah. But it was funny, as you were talking, one of the things I wrote down is empathy. And I think, we see that women, or feminine maybe, is more empathy. And I think that's a strength that you bring. We were chatting before the program. I've had medical issues, lots of different surgeries and all sorts of things. And I've had two primary surgeons in 10 years. And the first one saved my life. I was in septic shock. He did emergency surgery. He saved my life. Biggest putz in the world. There was a reason this young man, because he was younger than me, they all are now, right? But there was a reason he dealt with people when they were unconscious. He had zero bedside manner. Now, he was very skilled. I mean, one of the surgeries I had was over 7.5 hours, and he actually had to tap out. It was so long that but zero bedside manner. I mean, this was, but he was so proud of his work, and he's telling me about the papers he's going to write and I was like, and the senior partner in the practice, I happened to see on a weekend. I was in the hospital for long enough that, I got to see lots of different doctors. So I saw the senior partner, the opposite. This man oozed empathy. And he just, now, very beloved. I mean, he also was the chief of staff at one point, for the hospital. He, when they had the COVID shutdown, he was in charge. I mean, because they knew, and all I have to do is say his name and people go, ooh, right. But to me, his empathy was what, and he has this wicked sense of humor. I've been with him enough that, I see that. But, I think that is something, and I don't care what level somebody is, it is that empathy that gets us past the, oh, I hate being here. Even if it's just some of the simple things like, how are you doing today? And actually caring about that answer. We've all been to medical people where we start to say and they cut us off because they really didn't care. And I had one doctor who shook his finger at me, which always goes over well with me, right?
Well, if anybody, right?
Yes, and I was like, and he told me, you do not speak. You need to just listen to what I'm going to say.
Oh, I hate that.
And so but then of course, you talk about turning into a child. I turned into the petulant 12-year-old. And so I sat there and I listened to his whole spiel, which I shouldn't say spiel. What he was saying was good for 99% of the patients he would see. But I am such a special child that, it wasn't. And so I let him say all of it. And then he looks at me and he said, well, and like I said, petulant child, right? You told me not to talk. Which is not going to get us anywhere either, right? But obviously we were off on the wrong foot, and that was not going to get any better. But it is, and we see this in business too, right? Some business person sets us off wrong, it's not going to get better. And so, but to me, empathy, especially in the medical field, is something that everybody has to have. And it does, the bad part is, and I mean, I've talked with a lot of my guests about this too, about how business leaders really need to have empathy. They need to understand, they might not have gone through what somebody has, but they need to understand it. And for too long, we have thought of empathy as a feminine trait. And that, and the nice thing is that is changing, but it is still a challenge.
Oh, I thousand percent agree about empathy. And to tie it all in while you were talking this, I was thinking about this, since, this is the business power hour, I think that is something in talking about how can you grow a business or how can you be successful in business, whatever you're doing. Many of us in medicine, healthcare, we don't think of it, but it is a business. That's not, so we don't go into it because as a business, we go into it to help people. I think I mean, that's very cliche and a lot of people probably won't, they're like, oh, whatever. But I mean, that's very true. Like whether or not you say it, whether or not you even like acknowledge it or realize it, like you don't go into medicine if you don't have some level of wanting to help people.
Or you might, but you're not staying there.
Yeah. Right. So that's kind of what we are focused on, and we lose track. I mean, they don't really teach you business in medical school or dental school. I went to both. We don't really get business training. But it is a business. However, to tie it all in, you're 1,000% right, because doctors and physicians, nurse practitioners, whatever, who are the most successful are the ones that are more empathetic because they get more patients.
Right.
Because most people, like, okay, I was just talking to a colleague this morning who called me about a question about a patient who had a specific condition and wanted my opinion on it. And this patient that she had been, referred to a very specialized person who treats this condition. And I was like, yeah, that makes sense. So there are those people out there that are very specialized for certain conditions. And they've had like all this training. However, in the grand majority of things, like all of us here are very well accomplished. Like I say, like you can't fake being an oral surgeon.
Right.
Like the training's there, like the documentations are there. Like you can't like get that degree, like certificate without doing the work.
Right.
Okay. So like, yes, you could fake it. I don't know, on some level, but like it comes a point when you really can't fake what you're doing. Otherwise you're going to get in trouble. So all of us are very well qualified. Doctors are very well qualified. And to, again, to just kind of be grateful for what I do, like the general population does have a lot of overall trust in doctors. Like I know there's the studies out there that say like what are the 5 most like trusted kind of like careers. Doctors, physicians are always one of them. Lay people, religious people are one of them. Also like teachers, like those kinds of professions. So, they trust you before they even know you because you're a doctor. And people probably have different, like you, different ideas when they first meet a new doctor, like what are they going to be like? And I think that it is unique and unusual. I would say that people don't probably expect doctors to be empathetic. So just think of that. Like if you are empathetic, if you, show your patients some empathy, what a surprise that's going to be for them. What what a practice builder that's going to be for you. Your business is going to blossom because, and I always say this to patients, like I'm a specialist. So we do depend a lot on referrals because generalists refer to us. But the best referral is a personal referral from the patient telling their friends and their family because they have a bigger network than just, the different doctors that have their patient pool, whatever, but, they have a different network. So really empathy, one of the biggest compliments to me is when a patient compliments me and said, I had one this week and I'm always very grateful. He was like, you're the best. He's like, I'm going to tell all my friends to come to you. And that makes you feel very good. I had another patient who was like, okay, I like you. And you could tell that was coming from a very like hard person.
Right. And so that was the, oh my gosh, I think like, you're the greatest thing in the world.
I like people, but I don't like doctors, but I like you. And I think that speaks to your point of empathy because whether or not the patient maybe can identify it or we can even identify it, but there's a reason why they're like, okay, I trust you. And it is that empathy. I'm not just lecturing to you. And I have a lot of patients tell me like, wow, one tell me yesterday too. And I take it for granted even. So it just motivates me to continue to do what I'm doing and to be better at it every day. Is she's like, you gave me a lot of information. Like I really understand, like, and I realize that there are a lot of other people out there that don't, for whatever reason, don't take the time to talk to their patients. And again, it could be a big hospital system, and unfortunately, like they have to see more
you're
people.
Told you must see X number of patients in an hour,
and you don't have a lot of time to get into it. But you know, which is a problem and that needs to be addressed, because that's not the way to do it either. That's but there's, or you know, maybe they just, it's not in their, it isn't in their personality, it's not their bedside manner, but you know,
they're going to shake their finger at you.
Right. I mean, yeah, that may work for some people, but you know, again, in terms of growing the business of being a doctor, empathy, I think is so important, and it's a huge factor. And I think if you did that, you would be surprised at how much success you'd have and how your business would grow. And to that point, just a tidbit too, something that I do personally that I think really connects empathy, and then, you know, just connecting with your patients is, you know, I'm a huge sports fan, always been. Academics and athletics have always been a huge part of my life. Still are. I'm always active. But I love talking about sports, no matter what it is. So, especially as a female, you know, seeing male patients who maybe, as you know, they may be intimidated by a female, or they're maybe like, wait, you're the doctor type person.
Yeah, honey, yes, where's the doctor?
Yeah. And you get in, you introduce yourself, which I do every time I walk in a room. You start talking, and then you're like, oh, you have any questions? And then after like 10 minutes of going through whatever we're going through, they're like, wait, are you going to be doing the surgery? Like, yeah, we, you know, we covered that 10 minutes ago. So I like to, especially in a male who has any kind of sports.
You can talk about the Cleveland Browns. You can talk about.
I will always, and I usually wear a cap too, and so I'll have like, I have a lot of Cleveland Indians, Cleveland Cavs, Cleveland Browns, like depending on the season, I'll have that on, so that will spark conversation too. I think those little small like nonverbal cues definitely add to the experience of a person coming in potentially for something that, like, you know, maybe they're not excited to be there for. So I just think, you know, if you're looking for a way to connect with patients more, if it's harder for you, because it is hard for a lot of doctors, but especially surgeons, because again, we are very good at our craft. We're very focused on our craft, and that's where many of us are the most comfortable. But just those small acts can go so far in just the patient experience, which if you work at a hospital system, that's you know, that's very important for all of the administration. But even in any setting, it's so important, like, patient experience. You really want to, like, you know how what you trained and how what you're doing is really giving this patient a good experience or good your quality work. But this is something else that you know, I love this saying is, and I've read it many times, is like, patients don't care where you went to school, patients don't care your training, patients won't remember where you go to school, patients will remember how you made them feel. And that is so true. And if you're looking to be successful as a doctor, to grow your doctor business, I think that is a very good mission statement, or to follow every day.
Right. You know, and it really is sometimes just those little things, as you were saying, you know, that you introduce yourself. I remember when I was in the hospital, it was so funny. I got rounded on by 10 different doctors. I mean, I had lots going on, right? And I had this really spacious room because, aside from anything else, I had some pretty nasty infections, and so I couldn't have a roommate. But I had this window. I had this really huge window. And so the doctors would come in and they'd buzz past me and go stand and look out the window as they were doing their rounds, right? And you know, I was at the level where I didn't really notice. But then when I started being more coherent and paying attention, I thought, no. And so when they would come in and do that, I would say, excuse me, I need you to come stand at the foot of my bed where I can see you. And they always did. Nobody ever objected, because I don't think they actually realized they were doing that. Right. And so then, they always move. And I said, and I need you to tell me what your name is and what your specialty is, because that's going to make a difference on how I interact with you. And one actually said, well, I have a name tag on. And I said, show it to me. Well, it had gone under his lapel, right? And so he apologized. But, and they all did that. So one time, later on in the day, the infectious disease doctor came back in and sat down. I thought, oh, I'm dying. Right? Because he pulled up the chair and sat down. And he said, I have to tell you that what you told me about saying my name and introducing myself was probably one of the best pieces of advice that I ever got. He said, because my ego assumed that you knew who I was and why I was there. And he said, I will never walk into a patient's room again without telling him who I am and what my specialty is. And I mean, just that tiny little thing, right? Hi, I'm so-and-so, and I'm here to talk to you about X. It made a huge difference, especially to the patient, and I love that they call it patient-centered care. And I tell people it's called customer service, and y'all don't do it very good. But yeah, just simple little things very, like that.
Medicine's very, very behind the times.
Right.
We are hard and converts.
Yeah, but there's also the other side. There is the patient side. When I tell people we are our advocates, right? If we're not getting the right information, we need to ask for it. All of these, and there is that whole white coat syndrome. You mentioned it. Doctors are very trusted. We're also scared, right? And we don't want to know those really scary answers. We don't want to act like we're dumb. And so it's on us also to make sure that this is a mutually beneficial relationship. And that is different than in most business situations. But to me, it's kind of like whatever it is, I am paying whoever because they're the expert. Now, maybe they're changing the oil in my car. They're, doing whatever, but I'm going to get a better result when I ask questions, and do that. And so I think that's the thing that we all need to remember is it's a give and take relationship.
Oh, yes. Yes, absolutely. Absolutely. So I couldn't, agree with you, Martin. I love that. I love that you did that to that doctor. And I love, to his credit, that he came back and acknowledged it. I mean, just hearing that, just amazing. You validated me because I do that every time I walk into a room, but we get, and again, different centers, different things, but to your point also, it made me think, like, you're right. There's probably a lot of doctors who don't do that, because I've walked into rooms and I always, especially a hospital room, if I walk in, because from a doctor's standpoint, so many people come in and out of the rooms, people are sick. You don't know what they have, and so they don't know. There's so many people coming in and out. How can they even keep track of it? Knowing the hospital system the way I do, sometimes patients don't even know, like, so-and-so's been consulted. Like, they have no idea why.
Yeah. Who are you and why are you in my room?
So I always come in and I always introduce myself, and then I introduce my specialty and say, I, am oral surgery, maxillofacial, whatever. I'm here. Your doctor team asked me to come talk to you about this specific thing. And, I guess I never really realized it or take into account, but I have walked into situations where, like, oh, okay, yes, I remember you. And, oh, thank you for, people just say simple, like, yeah, thank you for telling me who you are.
Right.
Because people don't. And, I don't think it's, I mean, there's always arrogant people, right? But I think the majority of people, it's not arrogant. It's arrogancy or anything like that. It's just a busyness. People are busy and you're,
and we assume that we're remembered. I mean, I always retell people my name. Hi, I'm Deb Creer. Here's especially in a business situation. Because there's so much in our little brains that we don't always remember those things. And I am one of those people that am horrible with names. I'm always, looking at somebody's name tag and, all of those things. And I joke that sometimes I have to look at my own name tag to know who I am. But, and then you'll get a kick out of this, and I'm, squirrel, right? Now, if it's my medical people who know me. I don't do this to new ones because I don't want to freak them out. When they ask me my name and date of birth, I'm Anastasia Beaverhausen. And, but when I have to tell them the right name, I do, right? But yeah, I mean, it is something that we have to take responsibility for on both sides.
Yes. And you mentioned a little bit ago about advocacy too. I think that's very important. Is that, and I learned this from a very famous surgeon in Detroit, general surgeon, female, like she was, um, I don't know how old she was when I was there. She was older. So like she, was probably like in her 60s when I was training there. So she trained in general surgery at a time when it was very uncommon to have females in a very male dominated field. I don't even know, her name is Dr. Anna Ledgerwood. I mean, if you're from Detroit, you know that name. But she was very like just matter of fact. With patients, but patients loved her, loved her.
Right.
And I remember her telling us, she lectured us. I was on her service multiple times, as a med student and as a resident intern in general surgery. But she was like, I remember one of the points that she would tell the residents is, you have to advocate for your patients. If you don't advocate for them, who is going to advocate for them?
Yes.
And I've never forgotten that, never forgotten that. And it is so true. Because patients don't know. Patients don't know the medical system.
Right.
They don't know what they don't know.
Right.
And
then we do that lovely thing called Dr. Google.
Yes.
And that's a whole different discussion, right? Folks, don't do that. Just no. And I've fallen victim to that, in several times. But be careful. And AI, this is again a whole nother topic. Don't rely on going to whatever your AI is and saying, I might have or I do have, tell me more about it. Because it's pulling from everything. So it's pulling the good and the bad, the reputable and the non-reputable. Resist that urge, people. Resist, take fingers off the keyboards.
Yes, yes. And listen. That's what I would tell people too, is like, because a lot of people come in and we're all so busy and we just want to know, the high yield, like bullet points of what do I need to know? And it's hard to really listen, but that's what I would say too, on both ends, patient and doctor. We really have to take the time to listen.
Well, oh my gosh, this has been so fascinating. And what I like about it is, I mean, it really is such a great perspective of how to be a woman getting ahead. I don't care what the field is. It's hard. It's complicated. There's, a lot of downfall, but we're doing it. And so whatever we can do to encourage other women, maybe it's, helping with STEM programs, all of those various things, we need to do that. And so I'm going to challenge, people, men and women, think about this. How are we helping women today?
Yes, absolutely. I agree.
Well,
Obviously.
Your practice is in Cleveland and our audience is worldwide, but tell us a little bit more about, if you're in the Cleveland area, how do they find you and, what are the services that you provide?
Yes, absolutely. So yes, I am in Cleveland. So if you're in the Northeast Ohio area, greater Cleveland area, you're looking for an oral maxillofacial surgeon for, anything that we've talked about, any kind of jaw surgery, but also wisdom teeth, dental implants, full arch, reconstruction, pathology, or just an TMJ, I do that as well. Look me up. I have my own personal website. I'm also at the Clinic for Cosmetic and Maxillofacial Surgery in Independence, Ohio. So I can be reached there. I have my socials, obviously, that I can be reached directly. I'm at University Hospital's health system here in Cleveland. So I can be found under their listing as well.
Nice. And we do have a link to your website in the show notes.
Awesome. Yes.
Perfect. You. Well, this really has been absolutely fascinating. And it really, I think is hopefully going to make people think, which is the important thing, right? But do you have any final thoughts that you want to leave everyone with?
Oh, there's always final thoughts to be had, right? Well, I'll take that into two parts. One, for your business, what we've talked about today. Maybe think about how, if you want to be a better doctor, how can you grow your business, is really think about empathy, and taking the time to listen. I like that as well. Just give it a try. If you feel like you're in a rut or something, or, just always coming down, and just to the patient level and being grateful for what you get to do every day. Because I think we get lost in that. Unfortunately, the business part of medicine, the administration part of medicine kind of gets us bogged down. But at the end of the day, to the patient, we're still just the doctor. And just a simple gesture of, like what you said, introducing yourself. I still am a handshaker. I would advocate for handshaking. I know that kind of got dicey with COVID and all of that. I think less people are really worried about that as much, but there was a medical reason for that. But I think as a connection piece, I think it's very important, and I would advocate for it. I do that. I always extend my hand to patients when I meet them. I think that's a very good gesture. So I would encourage people, to give these little bedside manner tips a try. And then in terms of advocating for women in my field and for being a voice for women in my field, I just want people to know, just whatever it is your passion is, don't give up on that, no matter what people say. There's always going to be naysayers. Put them aside. And you are your biggest strength, and your authenticity is your biggest strength. We don't really talk about that, but for me, that's very, very important. Part of my character, part of my brand, part of my being is authenticity. Only you are you. And people can see that. I think people definitely can see people who are just trying to portray something that they're not. And so that will really also just excel your business, your brand, your everything. Be authentically you. And, reach out to mentors. Like we said, anybody, and that could be anybody. I mean, I'm obviously available if anybody around the world really wants to know anything about oral surgery, about being a woman in oral surgery. I'm happy to talk to people because I love what I do. And we talk about superpowers. Being a woman in your field really is a superpower, and take that and just run with it. So.
Such wise words, such wise words. I am Deb Creer, and I've been having so much fun talking with Dr. Jaclyn Tomsic. I was just going to crunch it all together. Dr. Jaclyn Tomsic. And until next time, everyone have a great day.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.